So an alternative way to provide a first rib manipulation or mobilization you can do in supine. If someone for whatever reason doesn't tolerate that extension and rotation position, this tends to work well with a little bit of the older population. So what you want to do is you want to control with your non-manipulation hand their lower cervical spine, and your thrust hand kind of comes into that space right where the scalenes are, and you push with the side of your first finger, you push that upper trap out of the way so you can get a really good purchase on that first rib. You're going to use that other hand, which is controlling their lower cervical spine. You're going to bring them into ipsilateral side bend, contralateral rotation, until you feel that kind of lock out. You're going to drop your elbow in onto your hip, so that way this is a body thrust and not just a push from your arm. And you're going to thrust right there. And you can kind of get a couple of good thrusts. You may not get a cavitation with this one, but that's okay. If that doesn't really work out or they can't tolerate a thrust, you can always get in that same position and hang out here, because all you're doing is rotating your body. It doesn't take a lot of effort. It's a really easy mobilization. Another option is if you bring the person up into a sitting position. It's a little tough. You got to get pretty up close and personal with your patient. So you place the contralateral arm up on your leg. You're going to make sure your thighs are really tight up against their torso. You're going to place your hand on the top of their head. Same thing happens with the side of your first finger. You brush that upper trap flesh out of the way and get a nice purchase on that first rib. You ipsilateral side bend the head towards to slacken those scalene muscles and get some mobility out of that first rib. You can laterally translate them to the opposite side and provide a quick thrust. You can also mobilize in this position because it puts that scalenes in a nice slackened position.